Welcome, ladies and gentlemen, to another exciting episode of This Pair of Reading Glasses, Bausch and Lomb. Anyway, so I just had good news on Facebook. The New Cary, or some people still for some reason call it New Hampshire, but it's not called that anymore. It's now called New Cary, or Nuevo Cary. Anyway, the Senate tabled, the New Cary Senate defeats House Medicaid expansion 13-11, tables its own bill. Okay, that's good. Now, some people might say, well, but Seamus, your wife's on Medicaid, and your Medicare premium is paid by Medicaid. That doesn't mean I want anything expanded. I'm glad I can get medication. You know, I mean, there was a time I couldn't get my medication, and that wasn't good. My wife, thankfully, can get her medicine now. To be honest with you, I'd be willing to pay more than what I pay for my medicine. I don't want to see all this stuff expanded. What I want to see are programs to help people get off of these status government whatever programs. I don't want to see more government. I want to see less government. There was a time we didn't have these programs, but people still got health care. The price of drugs wasn't sky high at the time because the companies knew they couldn't sell their drugs for $5,000 for a one-day treatment. So
basically racketeering is what it is.
Yeah, I mean now, especially with government price controls, they can, whatever they want price they want to put on it, because they know they'll get paid, but they'll be paid by the state. But there was a time, like I said, okay, people can afford to pay $5 for this medicine. Okay, so we're going to sell it for $5. Maybe we'll sell it for $6, maybe $7. But they weren't going to sell it for $500. When you add more and more and more taxes, when you add more and more regulation, more and more control, yeah, it is. For those who don't know, it's called corporatism, which is a form of socialism, which is also a form of fascism. And I am from a formerly fascist country. I'm not going to go into all that right now, but what happens in socialism, fascism, communism? 99% of the people become poor. 99% of the people cannot afford health care. 99% of the people, if they do get health care, it's CRAP. Now, one reason my wife is able to get her care, at least some of her care, is because people donate to various cancer organizations, and part of that has helped pay for my wife's treatment. Private funding. And the hospital where we had a lot of this stuff done is a teaching hospital, so their prices aren't sky high, and because they have to have the patients. They can't charge an arm and a leg and then exclude 90% of the patients, because they have to have enough patients so the student doctors, the student nurses, etc., will have patients where they can watch the senior doctors do their thing. They can learn without harming the patient. I mean, there was a surgical student. I mean, he was already a doctor, but he was studying to be a surgeon, that was in on my wife's surgery.
Which one? I don't remember him.
Yeah, he came in when we were still. Oh, you probably were
out of it.
Yeah.
I seen so damn many people that day too.
Yeah. And let me also say, my mom was a nurse. Okay, she was an RN, and back in those days, late 50s, early 60s.
Can't practice human medicine on guinea pigs.
Right. the nursing school my mother went to, Lankenau Nursing School, which was attached to Lankenau Hospital in Upper Darby, Pennsylvania, which is basically part of Philadelphia. I don't know if back then it was that much a part of Philadelphia, but today it is. It was ranked as one of the nation's best nursing schools. Now a lot of these formerly private nursing schools, private medical schools, etc., have all been taken over by the government. When my mom got sick, let me go through real fast what happened. My mother has Alzheimer's, and I went over to her house because, I'm like, I was going to check up on her. I mean, I had it with her, but
go visit her.
Yeah, I just wanted to make sure she was okay. Well, there's no electricity. There's no running water. She's not there. So I go over to the neighbors, and I find out they took her to hospital. So I go, and what hospital? I mean, I was hoping they took her to Methodist. It's actually the best hospital system in San Antonio. But no, they took her to University Hospital, which is the county hospital. But that, in and of itself, isn't a bad thing. You can get good care there, but you can get negative care there, or bad care there. It's like across the street, and there's a skywalk going over to the VA hospital. You don't want to go there.
Don't send your dog there even.
Yeah, I went over there to see somebody once, and the nurse was like, whatever. I'm sitting here doing whatever I'm doing. I'm not. You're just a waste of my time. That's not good medical care. That's government medical care right there. I remember seeing people sitting in they had an outpatient area. People would be sitting there all day long. They have an appointment at 9 a.m. They're sitting there all day long. I used to go to what they call the West Annex in San Antonio, which is a part of back then it was a part of what is now called University Hospital.
Tom hates going to the VA hospital, and it takes forever.
I might have a 9 or 10 a.m. appointment. I might not get seen till 3 o'clock or 5 o'clock.
That's ridiculous.
And then if they give you a script, which they usually did, for a while there, the only place you could get it filled was across the street in what used to be called the Brady Green. I don't know what they call it now, but Brady Green Hospital used to be an inpatient hospital. Now it's a government hospital. It's outpatient only. And what you have to do is you have to go up there. You have to get in line. You give them your script. Okay, and you had to stay there.
Oh, gosh.
They, let's say you got your script in 9 a.m. You might not get your prescription till 5 p.m. You could not leave, because if you left and they called your name, they took the medicine, they put it back on the shelf.
That's stupid.
I know. And it's like...
It shouldn't take all day to get a damn bottle of medicine.
No, and there was a time when I did go to the Brady Green to get my medicine, and it didn't do... It was like 20 minutes or an hour. Which an hour is still to me kind of long, but I could go to Walgreens, and I can get it in 10-15 minutes. Just like here, we can go to Walgreens, Target, and get it in, 5, 10, 15 minutes. But you go to a government facility, because they have all sorts of policies, regulations.
You could die waiting.
Yeah. And I'm sure there have been patients at University Hospital in San Antonio waiting in the waiting room who died. Let me say, you can get really good care there because it is a teaching hospital. And it's attached to the medical school, which, again, they have a skywalk from the medical school, which is called the Health Science Center, to the hospital, then a skywalk from the hospital over to the VA. I wouldn't go to the VA. Although their what do you call it? Not cafeteria. Like you have in a mall. Food court was excellent.
The only thing they could do was cook, huh?
Yeah. Because they had different restaurants that would rent space in there, so they had good food. But anyway.
At least you could eat. Know the food was safe.
Yeah. Once when I was in college, when University Hospital was a little different back then, when I was in college, we went on something called Urban Plunge. which was, we went to a couple of homeless shelters, which now are all government homeless shelters in San Antonio. Privately helping homeless people in San Antonio is now a crime.
Ridiculous.
I know. And we went to University Hospital, went to the ER.
Aren't there Catholic hospitals in San Antonio?
Oh, yeah. Yeah.
No.
But, I mean, like...
There's Catholic hospitals in every damn city, you know.
But, it's, I don't remember the name of it. But anyway, we went to the ER, and mind you, this is like a Friday or Saturday night, 2, 3 in the morning. So all the drunks, you know. And they bring this guy in. He had a heart attack. They are literally running down the hallway with him on a stretcher, working on him. I have respect for the people, the doctors, nurses, and whoever else was involved with that. I mean, they're moving. They don't stop and work on him. They're not walking. They're running down the hallway, working on this guy. I think it was a guy. I didn't get to really see the face or anything. There was that same night. They had this girl. Her ex-boyfriend had stabbed her in the chest more than once because she was going out with a girl who was sitting in the passenger seat of the car. And he was kneeling down outside. Oh, come back to me, I don't want to lose you. And she said, no, I'm not going back with you. So he pulls a knife and stabs her in the chest multiple times. We saw her twice. The first time she was uncovered. They had stopped, they couldn't save her, she was dead. This is how busy they were. And that hospital is a level 1 trauma center. They only have 2 level 1 trauma centers in San Antonio. Houston probably has 1 million of them, but it's a lot larger city too. But the next time we went around to that big circle, they had a sheet over her, but there were blood spots on it. They were so busy they didn't have time to get somebody to take her to the morgue, to the hospital morgue, and then they would have had to take her over to the coroner's office, which was at that time was in a bad place because, well, it was a bad building because the power would go out.
Oh, God.
And you could be driving down the freeway and smell it. So that wasn't pleasant. But they have a new morgue, and it's over there in the medical center, over by it's a part of the campus of the Health Science Center now. I always wanted to go watch an autopsy. I also want to go watch surgery, but anyway, so I think what would be best is if we decrease. You can't just cut programs. You can't just get rid of a program. You have to get rid of all these regulations and laws and things like that. So when you do get rid of a program, people can come in and help those in need. We don't need more taxes and more regulations. That makes things worse. That makes more people poor. It means that you restrict the ability for people to receive health care. You restrict the ability of people to find housing, to find jobs. You need to decrease these regulations, not increase them.
But things need to be more affordable than what they are.
Yeah.
Try getting a house up here without
here,
be a millionaire.
One thing they need to do is decrease the property taxes. They need to get rid of this campsite tax. If you pitch a tent, you have to pay a tax. This is a relatively new tax, but they need to get rid of that. But I want to commend the New Carey Senate for tabling the increase in Medicaid, but the fight's not over. They're going to bring it back again. Some people are trying to get. People have been trying to get a state income tax. We don't need that either. So, anyway, no, that's all I have to say. Thank you. Bye.